You know, obviously, Medicaid is the, as I said, my opening statement at the commission was the elephant in the room. And that was because without continuity of care, block grants, I don't want block grants. Block grants only pay for non-evidence-based treatment. You don't fight cancer with block grants. It's just, we got to get rid of
is block grants what's going on in the secret GOP negotiations?
They're using block grants as a way of really doing what they don't want to vote on doing, and that's sharply cutting the amount of money that goes to treatment. So they say they're giving the same amount, but they're letting states to do the dirty work because states' budgets are going to crowd out the funding, and the money's going to be fungible, so they'll use those dollars to fund other things because people with addiction and mental illness are the most unpopular of all constituencies, so they're the easiest people to drop by the wayside. But I think here's the big thing for the president is if he's going to ask for an 18% cut for corporate taxes, I propose that the White House make an objective for our country at a minimum to reduce suicide rates and overdose rates by an equal percentage for the American people. Because if we don't put our mind to something, we're never going to start bending the curve and applying ourselves to the goal at hand. So I think when you see the suicide rates and overdose so high, and all the scientists will tell you we can reduce those. We can reduce those quite dramatically. We know what to do to reduce those. But if we're not making it a goal of this country to reduce those, we're never going to get to where we need to go. So I would say make the reduction in suicide and overdose the same as you make corporate taxes, the reduction in corporate taxes. And two, if we're going to repatriate hundreds of billions of dollars of overseas corporate taxes, and this is the biggest public health crisis of our times, and it affects 1 in 4 Americans, why not say that we're going to spend $1 in 4 in repatriated money and put it into this, the biggest public health epidemic of our time. And let's build the infrastructure, because you're hearing from everyone that we don't have the workforce out there, we don't have the availability out there, we don't have the telemedicine out there. Let's build that out.